Hi, my name is Dr. Anna Baranowski, and I want to talk to you today about trauma response being a normal response to exposure to extreme stressors. So what is trauma? Well, trauma is really a stress reaction that feels explosive in the body. It's really an inability to really tolerate the emotional, cognitive, and physical sensations that go along and are associated with a traumatic event. So what is PTSD? PTSD has a number of different elements, but it hits us on our mind, body, emotion, and behavioral response when exposed to trauma. We experience intrusive symptoms like nightmares and flashbacks, and of course, we try to avoid the things that remind us of the difficult event. We have the strong feeling of wanting to avoid people, places, and things that remind us, and an increased sense of arousal, physical, emotional, mental, and behavioral distress when we're exposed to intrusive reminders. And of course, we're going to try to avoid things over time as a result. So if you're finding that you're not recovering, there are many trained people who can help. After trauma, it can feel like the bells and whistles go on, and we cannot seem to turn it off. Making sure you're not alone and in good company can help that. Having people around you who are caring can be an incredible buffer. After a traumatic event, sometimes we really don't know what's happening inside of ourselves. We can't make sense of it, and neither can the people around us. In fact, I've heard some people say that if only they could wear the bandages on the outside for the wounds they have on the inside. It just helps them feel like somehow their symptoms make sense, both to themselves and other people. Part of what makes our responses normal is that we're actually hardwired to remember those terrible things like the saber-toothed tiger in the cave, because that helps us to get out of harm's way. So sometimes we only have to learn something once to know that being afraid of it is actually part of our system built in to get us out of harm's way. That's how we respond quickly and get away from danger fast. From the perspective of evolutionary psychology, this is actually a good thing, because if we remember the things that are dangerous, we'll get out of harm's way pretty quickly. However, if we remember those things all the time, we're just going to be exhausted. Stress is a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. So if we don't learn ways to calm our bodies down, over time our bodies are depleted and we're more at risk of feeling unwell. Stress, left unmanaged, can lead to all sorts of physical and emotional health problems. So it becomes really important to find ways to lower the volume of that stress. The autonomic nervous system is a really important player in terms of stress response. It's involved in the automatic control of our organs and muscles. Sympathetic nervous system is all about fight or flight, and parasympathetic nervous system is about rest and digest. It's absolutely important that we use our fight, flight, or freeze when we need to get out of harm's way. But we have to also go into rest and digest when we're ready to find calm. We've all experienced times where we've been exposed to some kind of stressor and we have a natural and normal response. Rapid breathing, rapid heart rate, feelings of tension in our body. Knowing the early warning signs can help us from moving into a really deep stress reaction. Our brains are so important because they really are involved in how trauma memories get stored. The amygdala is our control center of the brain for emotions, and we can feel that almost instantly. The minute we feel a sense of danger, it happens so quickly that sometimes we can't stop our response immediately. Now, this is when it gets really interesting. If we've been exposed to a red car and had an accident, sometimes little cues, like just a red thing, can lead us to feel Like we are experiencing that same trauma of our car accident with a red car, and then we feel fear. We're seeing the red bicycle, but we're feeling fear. So this is like a shortcut through the amygdala to a full bells and whistles response, even though there's really no danger in the moment, leaving us feeling pretty stressed. Well, what really happens is that amygdala, that emotional control center, is really closely situated in the brain to the hippocampus, which is the part of the brain that stores the memory. And when we have a trigger or a reminder of the trauma, it ignites all the memories and the physiological, kind of the physical feelings of fear and strain and stress that went along with the original event. And that's really important to keep in mind, because that's why you have these strong reactions. They kind of go hand in hand. The memories reignite everything in the body, the mind, and the emotion. And when that happens, we have a cortisol release, and that's the hormone that's associated with stress response. And it actually creates a problem in the storage of our memories. So the storage of our memories is like fragments. So you might have this fragment of a red car, and now every time you see the red car, it ignites the same release of all the hormones, and the hormones make it very hard for the body to relax. So we have to work really hard at settling down our nervous system reaction. So that fight or flight or rest and digest, we have to really engage rest and digest and remind ourselves that in this moment we're safe. Experiencing post-traumatic stress disorder can feel like taming wild horses. You have to work pretty hard to grab those reins and manage the situation. So learning how to manage it early on and gaining the skills to do that can make the difference between living a life filled with lots of stress and managing well. The best way to do this is to learn how to harness calm. And harnessing calm is all about finding that center of the storm through daily practices that help us become resilient. We don't want minor stresses to rule our lives. We want to feel like we're in control, and when little things happen, we see them as little things. But when we're experiencing post-traumatic stress, it's hard to really keep that under control. Lowering the volume of stress means doing things that let us recognize that we are really able to let go of the past and move forward, that we can be in this moment, not in the past trauma or the future worry. And exercise can help us do that as well. So work-life balance is really important, and making sure that you're engaging with people, because that can be an incredible buffer in life. Sometimes people have a tendency to just work more when they're feeling stressed, when what they really need to do is find a way to decompress. So if you notice that you're having a really strong reaction to something that isn't really dangerous, that's a post-traumatic response. Our brains store memories along with all the emotional and physical reactions that went along with the terrible moment. So remember, it's really about staying in this moment and being aware. We find that the people that do best after trauma use daily practice, determination, and perseverance to retrain their body to find calm and relaxation. That's the most important job. And finally, just recognize that this trauma does not have to define you going forward. Dr. Baranowski from the Traumatology Institute, thank you for listening.